So not all brain surgeries are the same. There are many different types of surgeries that can be used to treat an underlying brain condition. And the choice of the type of brain surgery employed really depends on various factors. The most common surgery is what is known as craniotomy. Craniotomy essentially means opening the skull. So the skull opening really depends on the size of the tumor, where the tumor is located. It can vary between 3 centimeters to 5 centimeters skull opening, and that entirely depends on what the underlying pathology is. Apart from doing a conventional craniotomy, the other types of brain surgery come into the collective term of minimally invasive. Minimally invasive simply means getting into the brain through a smaller skull opening, and that can vary anywhere between 1 to 3 centimeters. Not all tumors are amenable to minimally invasive surgery, so it really depends on the size of the tumor and where the tumor is located. Sometimes surgery can be done through incision over the eyebrow. In some instances, you just need a 20 cents opening in the skull to pass very specialized instruments, for example, an endoscope into the brain. An endoscope is pretty much something similar to the size of the pen. Through a small skull opening, the size of a 20 cents coin, you can pass an endoscope into the brain and perform brain surgery. There are also conditions where we don't need to open the skull. We can essentially perform brain surgery through the nose, again using an endoscope. There are certain pathways and channels in the nose that allows surgeons to reach the brain, and we are able to then remove brain tumors safely through an endoscope by operating through the nose. More often than not, endoscopic surgery is done with an ENT surgeon, so 2 surgeons work together to remove a brain tumor through the nose. There are other conditions like surgery for Parkinson's disease, where again, these surgeries are done through very small openings in the brain. An opening of about a 10-cent coin diameter is made in the skull, and very specialized instruments such as navigation is used to pass through very specialized catheters to certain parts of the brain to bring about treatment for Parkinson's disease, for example.